Okay, hi everybody. It's Barbara Hodis and Lee Howard, and we're getting ready to begin our second in the webinar series. We appreciate you all participating in these. The topic today is the new chronic homeless definition under the HEART Act, which sounds really complicated the first 3 or 4 times you read it, but I think it's not as complicated as it feels like. So hopefully we will all be clear on it by the end of this. If not, as always, we are available for questions. And what's going on? Let's be with you in 1 second. The PowerPoint's not moving. Try it again.
F5 again. Try now.
And now it's moving. Okay, here we go. Anyway, this webinar will include several different topics, all related to the chronic definition. First is, why is it important to end chronic homelessness? Why does everyone care so much? The second one is, what does chronic homelessness look like in the Pennsylvania Balance of State COCs? Then we get into the new definition itself, the documentation requirements, and then related to all that is how that fits into the chronic prioritization policy that many of you have been hearing about. Hopefully most of you know about, but there may be those of you who don't know about it well yet or don't fully understand it. So we're going to carry it through to how this all fits into chronic prioritization. So why is everyone talking about ending chronic homelessness? When we first started hearing about chronic homelessness, the context was basically a Dennis Colhane study of Philadelphia and New York City and places like that, where there are numerous people living on the streets, significant amounts of people going in and out of hospitals, jails, emergency rooms, and back on the streets again. And it was a chronically homeless population, and it had many implications, one of which was primarily a financial implication. It was very expensive to serve people who are chronically homeless. It's now, I think everyone is looking at it a bit differently now than we did back at the beginning, and that is it's sort of a more human reason why we want to end chronic homelessness. These are individuals or families who have a long history of homelessness and lack of stability in their lives. They have multiple disabilities and health concerns, and it's widely recognized that housing and good health go hand in hand. They have had multiple stays in institutions, medical, behavioral health, and criminal justice, which are costly to society, but also not home for people who are looking to have a long-term home. And that folks who are drifting through this world of chronic homelessness don't have income, and they typically don't have their benefits. So that's how they don't even have tools to pull themselves out of the situation. So it's moved from the original conversation of dollars and cents to more of a conversation about this is the right way to treat people. And I like that change as it's been moving along. So in light of the need to end chronic homelessness, both HUD and the U.S. Interagency Council of Homelessness have prioritized ending chronic homelessness. So UCIH in their Opening Doors plan includes the goal of ending chronic homelessness by the end of 2017. This has been a moving goal. I think the first year that the plan came out, it was 2015. And actually, when the first talk about chronic homelessness came out, it was 2010. So there's a recognition that this is it's a serious problem in our country, and it's not easily solved. So the new goal is now 2017, which I think in some COCs is actually a quite achievable goal. HUD has also embraced this goal and awards points in the continuum of care competition of progress towards ending chronic homelessness. And when Lee talks about chronic prioritization, you'll see how it can actually be actualized and within our COCs. So there's a way to do it rather than the way it used to be just adding a few chronic beds a year. There are new strategies to ending chronic homelessness. So a little bit of background. Like I said, the concept was introduced in the FY 2002 COC NOFA. That's quite a while ago. And then it was just singles. In 2010, it was expanded to include families. The assumption was that it would encourage targeting of permanent supportive housing for long-term homeless. That the people who are homeless consistently for 12 months. What they found was, and this is including our balance of state, and I think a recognition that rural areas do experience chronic homelessness somewhat differently, that most of the people that were placed in chronic beds were those that met the definition based on at least 4 episodes in 3 years. And in many of our cases, those episodes were quite short, and then we occupied the permanent supportive housing beds. So there was a look at it and saying, wait, you know, we didn't define this in the way that we had hoped that we would be defining chronic homelessness, and that's why this was tightened up and changed. The cynics among us thought they did it to achieve the goal faster, because this is a harder, the new definition is a harder threshold to achieve, but really it was more a matter of being true to the actual mission of what is chronic homelessness and why do we want to end it. So looking at Pennsylvania, we're looking at our rural COCs, the eastern PA and the western PA COCs. What we did was just gave you a graph showing how it has looked over the past 3 years. So if you look at eastern PA, in 2013, the count was 188, dropped to 135, went back up to 156. In the west, 162 down to 134, down to 90. So pretty significant drop based on the old definition. If you would like to see where your county is within all of this, we just this morning had posted on the Continuum of Care PennsylvaniaCOC.org website the chart of all the point-in-time data for the last 3 years by county, and it's in the section for the eastern COC and then one in the western COC. So you can actually look at your own county and see what the numbers look like. This, in the 2016 count, we were told to use the new definition in counting, but there's a recognition that in a point-in-time count, the documentation isn't there. The ability to really do it under the new definition is very difficult, but the numbers for 2016 are using the best we can with the new definitions. We don't know what our numbers will look like. They are busily being analyzed. So the new definition's intent was to ensure that permanent supportive housing is available to those with the most severe needs and the longest histories of homelessness. And Lee will talk about that more in the context of chronic prioritization and a bit in the context of coordinated entry. It took effect on January 15th, 2016 for intakes that occurred beginning on that date. So if someone was already in the pipeline and looking for housing on January 15th, they could be under the old definition. Anyone who had an intake January 15th or later, they were under the new definition. So you folks have been operating under it for 2 months now. Okay, so let's just look at the new definition just so we're all clear on it. It is, 1, a homeless individual with a disability who lives in a place not meant for human habitation, a safe haven, which is a HUD-defined safe haven. There's one in Washington County and one in Westmoreland County, or an emergency shelter, and has been continuously homeless for at least 12 months. And throughout the rest of the webinar, this will be called 12 months continuous. Okay, so that's first part of the definition. Then the second part is, or homeless on at least 4 separate episodes for separate occasions. This is where it gets new. That first one was what it used to be. This is where it gets new. Homeless on at least 4 separate occasions in the last 3 years, where the total combined occasions must total at least 12 months. And that will be referred to throughout the webinar as 12 months cumulative. Occasions are separated by a break of at least 7 nights. If a break is less than 7 nights, it can count towards the 12-month homeless time. So if a person is in a shelter and then leaves for 2 or 3 nights, has a place to stay for a couple of nights, it didn't work out, they're back, and that's less than 7 nights, there was no break. They remained homeless. So that, in terms of counting towards either definition, that is not a break. That is still homeless. Okay, in addition, another change to the definition is that an individual has been residing in an institutional care facility for fewer than 90 days and met the other definitions of length of time homeless, disability, before they enter that facility. So if In other words, a stay of an institution of 90 days or less counts towards the 12 months of homelessness if they're homeless upon entry to the institution. Stays in an institution for more than 90 days become a break. So then it becomes part of the cumulative definition. If it's under 90, if it's 90 days, if it's less than 90 days or less, it is part of the continuous definition. And then third part of the definition is a family with an adult head of household, or if there's no adult in the family, a minor head of household who meets all of the criteria in parts 1 and 2. And this includes a family whose composition has fluctuated while the head of household has been homeless. So, of course, as with all rules, there are special circumstances and special little exceptions. So we'll look at a few of those. Time spent living in transitional housing does not count towards chronic homelessness. But if the stay in transitional housing is 7 nights, it's considered a break. So someone's on the streets, goes into transitional housing, that's a break in their homelessness. If they go from transitional housing to permanent housing, it's over. If they go from transitional housing back to homelessness, that would be break not one, so there would be two occasions. The first one, where they're in shelter, then the break, and then the next occasion back in shelter again. Not an ideal scenario, but we know it happens. And then we don't have a lot of VA grant and per diem programs in our balance of state COCs, but an individual who is chronically homeless when entering a VA grant and per diem program maintains their chronic status. And that's interesting because the VA grant and per diem program, when it was set up to mirror transitional housing, but is not being treated the same way under the definition. Okay. If a chronically homeless person is enrolled in a permanent supportive housing program and is looking for a unit, waiting for a unit to become available, they may stay briefly in a transitional housing program as a bridge until their unit is ready for occupancy. That stay in transitional housing cannot impose any rules or restrictions on the individual. It's a place for them to live till they can move into their permanent home. So again, that would not be a break. That is part of their homelessness. They've already been accepted into permanent supportive housing as chronic. If a household enters rapid rehousing as chronic, they remain eligible to transfer to permanent supportive housing for chronic, even though they are no longer homeless. And what HUD is basically encouraging is everyone to be housed as rapidly as possible. So if an individual, typically rapid rehousing is for households with lower vulnerability, not disabilities, greater likelihood of maintaining their housing. However, if you have someone with a disability and they're chronically homeless and there are no chronic beds available, but you do have rapid rehousing money, they may enter rapid rehousing and then transfer to a permanent supportive housing for chronic and still be eligible. Okay, so we do not look past the slide. I know it's really tempting, especially if you have 6 to a page, but try not to. We're going to try out kind of testing out the definition, see how well we understand it. So Sam has an opiate addiction. He's been living under an expressway during the warmer months for the past 3 years. So typically from April through October, he's living under the expressway. When it gets cold, he stays in an emergency shelter. So is Sam chronically homeless under the new definition? Yes, he is. He has a disability. He has an addiction, a long-standing addiction, and he's been continuously homeless for 12 months. So yes, he meets the new definition. He also met the old definition. Okay, this one is longer, and we're going to stay on it longer, okay? Because I think this is more like the types of situations that you will encounter. Sue and her 2 children stayed in an emergency shelter for 3 months. Sue has mental illness and entered a psychiatric facility from the shelter for 2 months, and her children were cared for by a relative. When she was discharged, Sue and her children moved into transitional housing program where they stayed for the next 12 months. Sue obtained employment, and they then moved into a rental unit in the community. After 4 months, Sue lost her job, and she and her children lived in her car for the next 2 months, then returned to emergency shelter where they stayed for another 2 months. While in shelter, Sue developed a romantic relationship with Harry. Harry had a job and was able to move to an apartment and invited Sue and her children to move in with him. After 6 months, Harry became abusive, and Sue sought assistance from a domestic violence program and stayed in their shelter for the next 30 days. While in the DV shelter, she applied for PSH. Again, try not to peek ahead. What I'd like you to do is go back through that scenario and make a list of the homeless occasions and the length of time of those homeless occasions and the breaks. And we'll take like a little bit of time and do it on your own, and sort of like on a scratch pad. Occasions of homelessness, length of time homelessness, and breaks. Okay, here we go. So, for 3 months, she was in emergency shelter. That was homeless episode 1. And then for 2 months, she was in a facility. That's still part of homeless episode 1 because it was less than 90 days, and she was homeless when she entered the facility. Then she moved to transitional housing where she stayed for 12 months. That would be a break because it no longer counts towards homelessness for the chronic definition. And then she did well in transitional housing, 4 months in an apartment, so she's still the same break. So homeless episode 1, homeless occasion 1, break 1. Then she went and lived in a car for 2 months, homeless occasion number 2, and then in an emergency shelter from there, still part of homeless episode 2. 6 months in an apartment, break number 2. Back in emergency shelter, homeless occasion number 3. So she had 3 occasions totaling 12 months. So does she meet the chronic definition of cumulatively homeless? Well, she had a disability, so there she met that piece of it. She was not continuously homeless for 12 months. The most she was continuously homeless was, I believe, 5 months. She was not homeless for a combined 12 months. She was homeless for a total of 10 months, and she didn't have 4 or more occasions of homelessness. She had 3 occasions. So she did not meet the definition of chronically homeless, even though she had many episodes, she had many different experiences and would be considered highly vulnerable. She did not meet the chronic definition. All right, let's go on to Carl. Carl is living with AIDS and has had numerous hospitalizations to treat opportunistic infections. Because of his frequent illness, he has not been able to maintain a job, but does receive SSI. His SSI is only adequate for him to rent a room by the month, but not to enter into a long-term apartment lease. Carl was living in a boarding house for 6 months, then had a 1-month hospitalization. His room was no longer available upon discharge, so he went to live in an emergency shelter for the next 5 months, and then found a room for 2 weeks and was hospitalized again, this time for 2 weeks, then returned to the shelter for another 2 months, when he was hospitalized again for 1 month and returned to emergency shelter for 4 months. At this time, he applied for PSH. Upon intake, was he eligible as chronically homeless? And we'll wait a little bit if you want to do a little scratch pad looking at this one. Okay, so let's look at this. He had 5 months in emergency shelter. That was homeless occasion 1. He had a rented room and 2 weeks in a hospital, so he had a break. He was in emergency shelter for 2 months, and from there he went into a hospital for a month, so it's still homeless, and 4 months of emergency shelter. He had 12 months of homelessness, but only 2 occasions. For cumulative definition, the 4 occasions is a statutory requirement. So, no, he does not meet the new definition. He had a disability. He wasn't continuously homeless. He did have his combined 12 months, but he did not have the 4 or more occasions. And in fact, someone sent us in a question similar to this about someone that they're meeting with right now, and it said they have 12 months cumulative homelessness over the past 3 years, but do not meet the statutory requirement for 4 separate instances. And they have severe service needs. So she wanted to know where does that put them in terms of prioritization because they don't meet the chronic definition. And Lee will address the second part of that when she talks about prioritization. So this, when you read about Carl, your first reaction is, oh my goodness, this is definitely someone who in theory and in the feeling of the definition should be eligible. And I think there's a recognition at HUD too that yes, Carl is highly vulnerable, has high service needs, but they are stuck with that 4 occasions in 3 years, which is why the chronic prioritization becomes very, very important, because someone like Carl does need housing as quickly as possible, yet he can't qualify as chronically homeless. So we're going to take a break right here. And, oh, I forgot to tell you at the beginning, and I apologize. If you have questions, please type them in the box. And Dave's going to look to see if there's questions, or you can use the hand-raising function, and Dave will call on you. So, Dave, do we have anything on there now?
The only question was related, and it was answered based off of this third scenario, related to a person having being homeless for 2 times in 3 years, totaling up to 12 months. And obviously that would be a no because they don't have the 4 or more occasions in the past 3 years. They only have the 2. Okay,
thanks, Dave. And I apologize, everyone, for not giving you that instruction at the front end. So we're going to stop several more times for questions. So please, please, please ask your questions. But anyway, this statutory glitch is something that we expect more guidance on, and it is definitely recognized that there are people who will fall into this unfortunate hole. Okay, so now how in the world do you document this new definition? It is hopefully not as complicated as it feels, but let's give it a look. Okay, so what do we need to document? We need to first document their homeless status, and we talked about the homeless definition in the last webinar. We need to document their disability, and we need to document their length of time homeless. So 12, under the first part of the definition, 12 continuous months. On the second definition, 12 cumulative months, which really translates into counting breaks more than counting homelessness. You have to count 2 things. You have to count the month homeless, and you have to count the breaks, with stays in institutional care facilities fitting in with this. And the final rule has these words in it. Failure to maintain appropriate documentation of a household's eligibility is the monitoring finding that most often requires recipients of HUD funds to repay grant funds. That was scary, so we therefore felt the webinar was in order. And remember, record keeping is key. If HUD comes out and monitors you, record keeping is the biggest thing that agencies get findings on. So what are the record-keeping requirements? Permanent supportive housing programs with chronic dedicated or prioritized beds must follow written intake procedures. Let's stop there for a second. Many programs applied as chronic dedicated programs, especially new bonus programs after the last several years. But starting, I believe, in 2013, HUD added this new category of prioritized, and they strongly, strongly, strongly encourage permanent supportive housing programs to prioritize their beds for chronically homeless. So that means if you're a permanent supportive housing provider, you either have dedicated beds or non-dedicated beds, but most likely either all or most of your non-dedicated beds were prioritized either in the 2013 application, 2014, or 2015. This year, Lee's still awaiting a response from HUD on how we count prioritized beds in the, on the HIC, whether they get counted in with chronic, whether there's 2 different numbers. We're not sure exactly how the prioritized gets handled on the HIC, but we do know it's going to be on the permanent supportive housing. Your prioritized beds are in your contract. You have prioritized them for chronic. And unless you cannot find someone chronic, they get treated as a chronic bed. And we'll talk more about that as we go through this. You must, as an agency, as a program, have written intake procedures. And these procedures require documentation and intake of the evidence relied upon to establish and verify chronically homeless status. And then there's an order of priority of obtaining evidence, and it's much like when we talked about the definition in the last webinar. Third-party documentation is the gold standard, followed by intake worker observations, followed by certification from the person seeking assistance. For families, this is for chronic. For families, the adult head of household, or if there's no adult in the family, a minor head of household, must meet all criteria to be considered chronically homeless. Okay, so the head of household. If it's a non-chronic family, the child may be the individual with a disability. But for chronic, the child may have a disability, but it's the head of household that must have the disabling condition. Okay. We're not going to go back to the literally homeless definition again, but if you go back to the first webinar, Project Eligibility and Homeless Documentation, the definition is Category 1, literally homeless. The definition is on slide 5, and the documentation requirements are on slides 38 and 39. Similarly, documentation of disability. If you go back to webinar 1, the definition is on slides 51 and 52. Documentation is on slides 53 and 56. You should all have those slides. They were sent out to everyone, but if you can't find them, they are on PennsylvaniaCOC.org. Documentation of institutional stays. Remember, institutional stays of less than 90 days count towards the length of time homeless, both continuous and with the cumulative. So the documentation we would be looking for would be discharge paperwork or oral referral from a social worker, case manager, or other appropriate officials stating the beginning and end dates of the time the individual was residing in the facility. Because for this case, we need to know the number of days. If it's over 90, that means they were, it's a break. So that the length of time in the facility is important. If this is not obtainable, a written record of the intake worker's due diligence to get the information and the individual's self-certification that he or she exited an institutional care facility where he or she resided for less than 90 days. Okay, so looking at documentation for length of time homeless, and this goes for both continuous and cumulative. You must document the length of time in a place not meant for human habitation, an emergency shelter, or a safe haven. Third-party documentation is preferred. However, if there's a gap in the third-party documentation, up to 3 months can be documented through self-certification. In limited circumstances, and we'll talk about those in a second, up to the full 12 months can be obtained through self-certification. But it is recognized that there are going to be times when there's going to be documentation that is hard to get, and it could be a real puzzle. If you remember, even the examples that we just gave you, tracking each of those little pieces could potentially be really challenging. So again, for both continuous and cumulative, a single encounter in a month is sufficient to consider a household homeless for the entire month unless there is evidence of a break. And this part of the definition, we think, really relates largely to unsheltered people. Like an outreach worker saw someone living under the bridge, recognized them, saw them once, maybe twice during that month, and then didn't see him again, encountered him again the next month. That is sufficient knowledge to consider that person being homeless both of those months. However, if that person's name is, if there is absolute evidence that person was moved to a transitional housing program or a permanent supportive housing program and left that program, and there's evidence of a break in HMIS, that means there was a break. But if there's no evidence of a break, it's enough to know that that person was homeless from those 2 encounters. Similarly with shelters. If they're known to have been in shelter 1 month and they're known to be in shelter the next month, the assumption is that they were homeless for 2 months. If third-party documentation cannot be obtained, the following are required. Evidence of the intake worker's due diligence to obtain it, the intake worker's documentation of the living situation, and the individual's self-certification of the living situation. So if you can't have third party, you need to show all the detective work that was done to document the person's history. Okay, so if at least 9 months of homelessness cannot, if at least 9 months can't be documented by third-party sources, that means if 3 months, you want at least 9 months documented. How does, like, big on double negatives? You need 9 months of documented time homeless. 3 months can be self-certified. Up to the full 12 months can be self-certified, but there are restrictions on that, because no more than 25% of the people served in a single project during an operating year can be self-certified. So that means if you have 12 people served during an operating year, you can only self-certify 3 of them. Thorough documentation of attempts to obtain the third-party documentation and why third-party documentation was not obtained must be in the file. So it is recognized that you're not going to be able to document everything. However, there are limitations on how many people can be self-certified, and there are very clear need to collect all the history. For the 12 months continuous, third-party documentation, you have to determine if there are 12 months of continuous homelessness and no evidence of break. If there is evidence of at least 1 night in shelter each month for the last 12 months, it is not necessary to ask about breaks. If there's a stay in transitional housing, however, amidst that time, even though the person is still regarded as homeless in the point in time count, they're not homeless in terms of chronic. So if there's a stay in transitional housing of over 7 days, that would be a break, and the person would no longer be considered continuously homeless. Okay. If there's not 12 months continuous in HMIS, but the client reports that he or she has been homeless for the last 12 months with no breaks, identify other third-party sources. And those third-party sources would be shelter providers that are not on HMIS. We have a number of those. Outreach workers, law enforcement, other professional sources, others that can document that person having been homeless during those 12 months. The highest, again, the highest level of documentation is HMIS. From talking to Dave and Brian, it sounds like it will be hard. You can use HMIS at this point to do it, but it may be difficult because many people do not agree to sharing of data. Dave, you'll correct me if I mess this up, but apparently you can go to the dashboard in HMIS, locate a person, and see their HMIS history. So you can see they're in Shelter A, Shelter B, Shelter C. However, if that individual has not agreed to sharing, or if Shelter B isn't on HMIS, this data will be of limited value. The hope is, over time, this will be a truly good source, but right now it is not as useful as we'd like it to be. Okay, 12 months cumulative. How do you document that? You need evidence of breaks. Okay, that's really where the evidence on the cumulative is. What are the breaks? And they can be documented by third-party evidence, self-reporting of the individual seeking assistance, and I think this part's interesting. 100% of the breaks can be documented by self-report. So if someone says, oh, I stayed in the men's shelter for 3 months, and then I went to live with my sister Sue, and I stayed with her for 2 months, and then I went back. Each of his breaks can be, you can take them from that person, you just have to put it in the files. All right, length of time homeless. How do you document that? Again, you start with HMIS. Determine if there are 12 months of cumulative homelessness over the last 3 years with at least 3 breaks. Again, it's going to be very hard to use HMIS, but over time we'll get there. If there is not HMIS documentation of 12 months of homelessness, interview the client and other third parties. If there is not HMIS documentation of 3 breaks resulting in 4 occasions, have the client identify and certify the breaks. So first you look for third-party documentation, and then you go to talking to the person about their history and having them explain to you where their breaks happen and certify those breaks. Okay, we're going to stop there. And we are also open to, if people want to either give us an example of a case that they are currently challenged by, do the hand raise, and we will try to work on it over the phone together, see if we can do that. If not, please send it in to us, and we're working to put together sort of an FAQ from the various webinars so that information can get out to everyone. The other thing that we have been hearing, and we're not certain if this is across the board or just some isolated counties, but agencies have been having trouble getting the disability documentation. Getting appointments for diagnoses has been difficult, and that has been slowing down the ability to document chronic homelessness. So if you want to give us some examples of that now, send it in to us, and then we can work towards sort of having full information for everybody. So it is now open again. Dave, do you have any written questions there?
Excuse me. I have 3 written questions.
All right, go with number 1.
First 2 are like clarification. The first one is we have people who have been living in the woods for years and didn't have contact with social services in any way. Is getting their self-certification acceptable in this instance?
Okay, so, Lee's going to say, Lee's faster on the draw than I am. Go, Lee.
Absolutely. I mean, they would still need to have a diagnosed disability. They would still have to meet that piece of the chronic definition. But in terms of being able to use self-certification to certify either 12 months of continuous homelessness or the number of occasions within 3 years, 4 more occasions totaling 12 months or more within the 3-year period of time, that also could be done through the self-certification. Again, Barbara put the caveat in that only 25% of project recipients of people in permanent supportive housing projects can be self-certified for the full 12 months. But assuming that a project is operating and has a turnover bed, this is going to be sort of probably the first or second person who would be self-certifying. Unless it's a very, very, very small project, you should have some time and the ability to use the 12-month self-certification on some folks before you run up against that 25%, excuse me. Barbara, were you going to add something to that?
No, that's exactly it. Thank you.
The next question is, can a third-party documentation be a family member?
Oh, that's a good one. It typically says a shelter provider, a professional. We don't know.
I'm not sure. I think that in some cases it would be a family member if the individual, for example, was living doubled up and then left to become unsheltered or something in that along those lines. A family member could certify Tim was living on my couch between these dates, and at that time he left and he was sleeping in his car, in the Walmart parking lot, for example. That, I think, would be an acceptable use of a family certifying his homelessness.
I agree.
In terms of whether or not it meets that quote-unquote third party, I think that deserves a quick look by myself or Barbara, and we can check that and follow up or send it in to HUD just to verify.
Okay, so the next question has 2 parts to it. First part is, how does couch surfing with friends/families count towards instances of homelessness or breaks?
Does not count.
It counts
it's a break.
As break.
It's breaks because it's not homeless. It is breaks.
Okay. And the second part to that is, how about an individual staying in an attic or basement?
I think that it depends, to be honest. Most likely it would not count. It would still count sort of within that doubled up, assuming the individual is in fact staying in the home of somebody and not in some sort of abandoned home. But if the home is habitable, whether or not that individual has a proper bed or anything like that would be irrelevant. Most likely it would count as a time and a break. If somebody, whoever asked that question, has more detail that they want to either be unmuted for to explain or to contact us directly afterwards, we can discuss it further. But most likely they would not, that scenario would not count towards somebody's time homeless or an occasion homeless.
Okay. Dave, are there any more written questions?
That is all the written questions.
How about any hand waves?
So no hand raises. I just want to reiterate again, there's two places, and I just remember that depending on the browser that you're using, there's two places that you might find the raise hand feature. There might be a panel on the right-hand side that has participants and a hand that looks like it's raising, or if you move your mouse to the top of your screen, you should see that your desktop drop down. It'll probably say Viewing HOTUS Barber's Desktop at the top. If you hover over that, it'll bring that down. If you click on Participants or Chat, you should be able to see that hand-raising feature if you wanted to be unmuted and ask a question.
Thanks, Dave.
Okay. We do have one question that came into the Q&A. It's are individuals who are living other housing in other housing programs considered as being on a break?
Yes, that is a break. Living in a permanent housing or transitional housing, that is a break because they are not homeless. So if they were homeless prior to that and had a disability, are living in permanent supportive housing, maybe public housing, maybe got evicted from public housing and are back homeless again, living on the streets, that point in time, that period of time in public housing is a break in their homelessness. So it would go into the cumulative. The only definition at that moment that they'd be eligible for would be the cumulative definition unless they were homeless for another 12 months continuously after that. That is a break.
The only caveat I will add to that is if somebody enters a rapid rehousing program, that time in rapid rehousing does not count towards the cumulative or the continuous.
Right.
However, they do maintain their chronic status. So they could still move into a permanent supportive housing unit as chronic if they are currently in rapid rehousing and met the current definition prior to entering the rapid rehousing program.
Correct. Thank you.
Thanks, Lee. I was just getting ready to add that from the first webinar. I remember that being a question. We have another question. If a shelter or MHID was sending a client to get a Shelter Plus Care voucher through MHID, and that client was a chronically homeless client, would all of the documentation need to come along with the referral?
Well, I mean,
all the documents. What you want to do it, Lee? Go on.
I'll just add something and ask Barbara to chime in. But basically, along with the referral, one of two things needs to happen. Either whoever is providing the referral, and if you said that, I apologize, should ensure that the individual has all the documentation ready to go and available, or the permanent supportive housing provider, upon receiving that referral, can work with the individual to pull those pieces of information together at that time. It probably happens somewhat differently in each place based on the relationship and the agreements in place between the provider on both ends.
Yeah, no, that's exactly right. They have to have, basically every program upon intake must get that information. The easiest way is if it arrives with the person. If not, they have to do all that research to make sure they have all the information before they can accept the person into the program. And again, this hopefully with coordinated entry will become less complicated and be built into the system. But for now, that's why we wanted lots of people on this webinar, not just permanent supportive housing, because everyone in the system is making referrals to permanent supportive housing. So the best that emergency shelters and everyone else understands these definitions, the better the referrals will be and the better the documentation will be upon intake.
The other thing I would add to what Barbara just said is that if you are working with a community partner, whether it be a shelter, MHID, or whoever, and you feel like this information would be useful for them to hear, as we previously indicated, the webinars are being recorded, and the link will be available online within a few days to a week at the most. Please feel free to encourage them to watch this information, to understand what the documentation requirements you will need in order to be able to house these folks, to even prioritize them as we're about to review. But encourage them to give this a listen and therefore be able to be a more active participant in collecting this necessary documentation. Anything else, Dave?
That is all the questions we have right now.
Okay, great.
Okay, thank you. Lee is now going to be the voice you hear. Here she goes.
This is what happened a minute ago.
Escape.
I think so.
And our
computer
has locked
We're
up.
having a technical difficulty. Okay, now hit F5. Hopefully it will go to the right screen. Oh, and it did. Good. Okay. Hi, everybody. This is Lee Howard, and I'm just going to present the next several slides. Sure. Okay. As Barbara indicated, we are on to permanent prioritization for permanent supportive housing beds. The next several slides are going to be applicable, I should say, to chronic households, those who meet the new definition, and then we're going to discuss prioritization of permanent supportive housing beds for non-chronic households. So that image you see on the left side of your screen there is a document, a HUD notice that was released in July of 2014, and the subject of the notice was, and I quote, "Notice on prioritizing persons experiencing chronic homelessness and other vulnerable homeless persons in permanent supportive housing and record-keeping requirements for documenting chronic homeless status." Snappy title and HUD folks are available to help you name your next event. I couldn't help but to read that because it is such a long title. But the reason I say that is to bring to your attention that it does include some more details about chronic record keeping and documentation within this document. If you Google that snappy title or even just HUD notice CPD 14012, you can obtain the full document. What I will say about this document is that even prior to the 2013 COC applications and the project renewal applications that were submitted to HUD, our COCs, at the time there were the 4 RABs, but now the Eastern and Western, our permanent supportive housing programs, were being asked for the last several years to prioritize individuals experiencing chronic homelessness for permanent supportive housing turnover beds. This is something that had been done in practice by our COCs for a pretty considerable amount of time. In 2013, HUD officially included this as a question in the renewal applications for permanent supportive housing programs. And for those programs that did commit to house chronic in their permanent supportive housing turnover beds, that was written into their HUD contract. That was maintained in the 2014 renewal applications, and then in the 2015 that we just submitted last November. And so this is, like I said, this is something that's been going on for a while, and even when HUD put this into effect that it became part of the contract, it was more of our request from HUD to prioritize chronic for turnover, but it didn't go any further than that. With this notice that was released in July 2014, HUD went a step farther to say, this is who we want you to prioritize, even within that chronic definition. And we'll go through that now. In order to implement the notice, the COC, both the Eastern and Western COC boards, passed the policy, which was sent out along with the webinar. If you haven't seen that, I would encourage you to take a look at it. We're going to go through really the highlights of the policy, which mirror the notice from HUD. But I just want to point out also that these policies and the notice from HUD were both developed prior to the release of the new application. So there's a couple things, and I will point them out, but that are relevant to the old chronic definition. As soon as HUD updates this notice or provides additional clarification, we can update the COC policy to reflect that newer information. Okay, so just to review this quick chart here, this is the prioritization that HUD is recommending, and if you go to the notice again or the policy, it has all of the words, not just a quick grid, but it has all of the words in terms of how to prioritize that 1, 2, 3, 4, those 4 categories there, as noted on the left. So as the second column says, meets HUD's chronic definition, yes, all 4 of these are within the existing chronic definition. The third column says has severe service needs. How is that defined? First of all, it's further defined in the notice and in the COC policy, but in a nutshell, high service needs basically implies that the individual or household is a high utilizer, frequently uses crisis services, or needs a significant level of support to maintain their permanent housing. In some cases, many communities are identifying those with severe service needs based on the SPDAT, the assessment tool that many communities are using as part of their coordinated entry. In some cases, folks are using some type of vulnerability index, whether it be connected to the SPDAT or otherwise. And in some cases, communities who have very sophisticated data systems may be able to use things like their Medicaid utilization rates, et cetera. But basically, the standard that you could use is that they are high utilizers of crisis services and/or would need a significant level of support to maintain permanent housing. Once our COCs, both the East and the West, are fully using a coordinated entry system and using a consistent assessment tool, whether it's the VI SPDAT, I know the SPDAT is going to be used on the eastern part of the state. In the western, there is a customized or assessment tool that will be used, and once the vulnerability information is pulled from that, we can have some sort of consistent determination of whether or not somebody meets that threshold for severe service needs or not. But for the time being, I would utilize the definition I just mentioned. And then finally, the fourth column there says other requirement, and this is really where you get into where the old definition is still part of both the HUD notice and the COC policy. So the first box there underneath Category 1, and we're going to go through this, but it says either 12 months continuous or at least 12 months cumulative across 4 episodes in 3 years. Moving down, it has both there as well. And for the third category, it says less than 12 months cumulative across 4 episodes of 3 years. And then further, the same definition for number 4. So what you see there between 3 and 4 underneath that other requirement column is that they really were prioritizing those with continuous homelessness versus the 12 months of cumulative time. So going back to the top, Category 1, this is of those, if you are bringing somebody who is chronic into your program, these are the orders of priority that should be used. Assuming that you have more than one chronic person on your waiting list or who has been referred to you and you only have one bed, or the point is that you have more people needing assistance that you have access to than you do resources to meet those needs. So first, level of priority goes to somebody who has a high service need and meets the current definition, okay, in terms of the continuous or cumulative time. The second priority then goes to somebody who does not necessarily have the high service need, but still meets the time of the current definition. 3 and 4 are a little murky because HUD, again, is saying they're referring to something that is now part of the old definition. But what I would say to you until we have further clarification from HUD is that the third priority is, again, for somebody who has a severe service need, and that person would be prioritized over somebody who did not, as in number 4, and you would, again, be prioritizing somebody who has a longer length of time homeless than not. So if you didn't have somebody who met the first and second level of prioritization and you were down to number 3 or 4, you would be making that determination based on which of these individuals has a high service need and which has been homeless for the longest length of time. Hopefully that is clear, and if it's not, feel free to raise your hands and or submit a question and we can go over that. But again, part of the issue here is that in the case of number 3 and 4, we're using the old definition. In the case of 1 and 2, we're meeting the new definition, but that is the definition. So it's a little bit murky in that way. Hopefully HUD will release some type of clarification very soon.
They actually have said that they're reintroducing the prioritization, and it should be out at least in advance of the next application, if not before then.
Thank you. Next slide, please. Okay. So what does this mean? What is the process for taking all of this information and actually being able to use it to identify somebody in your for your program for a turnover bed? So what this slide really is to represent sort of the procedure for the balance of state COCs. So if you have folks, the first priority is going to go to chronic households that are already on your project waiting list. So assuming you have one turnover bed and more than one household on your waiting list, you would look through the histories there of those households and determine who should get the unit based on A, who is chronic, and then B, within that 1, 2, 3, 4 prioritization level of the chronic. If you only had one person who was chronic on your waiting list, that would be the person who would get your turnover bed. Okay, next bullet. If no chronic are on your waiting list, identify chronic in the project service area. That says project service R, it's missing an A, but it should say project service area. So whether that be your county or your region, your defined project service area is in your HUD application. You have probably stated that you will be serving folks in, Cumberland and Perry counties, for example, or Cumberland County only. Whichever it is, that would be your defined service area. For the new projects that were submitted, many of them in the 2015 application, the service area was the entire RAB. So that's something that we will, again, once those projects are hopefully funded and operating, we may have to update this procedure, but for right now, this is the procedure that we are using. So no chronic are on your waiting list. You're going to identify chronic within the service area. This can be done through advertising available beds to providers, next through the entire COC. So that's sort of the third level. Nobody is within your service area. You're then going to advertise your bed to providers throughout the entire COC. How is that done? In the East, it seems like the most commonly used tool that I have seen has been the Wigio. In the West, there is an identified county contact for each county who, if a permanent supportive housing provider has an open bed and is looking for a chronic household, that information is distributed to each county contact, who then work with their contacts on the local level to identify somebody who is in fact chronic. Next, if no chronic household is identified within 7 days of the vacancy, you can then use, the unit can be used for a non-chronic household, and therefore you're going to use the non-chronic prioritization which we're going to go through in just a moment. Dave, before we move on to that, that was sort of a mouthful of information. I just want to make sure folks have an opportunity to pose a question if there's any confusion.
So, Lee, we had a total of 4 questions, and you answered 2 of them.
Okay.
But you answered 2 of them already, so I'll start with the first one. It's, excuse me, although following the prioritization for non-chronic, we would still have to fulfill our grant specifying the person would have to become, or would have to be coming from a shelter or street and have a disability as well, correct? Yes.
Correct. Yes, absolutely.
Okay. For example, okay, they just gave an example. If no disabilities, then we could not house them, correct?
Correct, and that's the case for anybody listening, whether or not this is a chronic bed. In order to be eligible for permanent supportive housing, you have to have a disability. And that includes old Shelter Plus Care programs as well. Shelter Plus Care or SHP, either one are now both are called permanent supportive housing under the HARF and the updated COC regulation.
Okay. The next question is by the same person. Also, we don't have any identified in our county to keep or update the county list. I don't have anyone, excuse me, to update the county list. Who would we call in order in our county to find out if there is anyone on the wait list? And I guess I would have to find out who that county is, where they are at.
I would ask that whoever that submitted that question, if you would just either give myself or Barbara a call or send an email to pa_coc@hotmail.com or one of us directly, whichever way you have to get in touch with us, please feel free to reach out to us directly, because without knowing more about if you are a permanent supportive housing provider, what county you're in, et cetera, I'm not sure that I can give an accurate answer to the question.
And who do we send the chronic prioritization turnover unit survey to?
Okay, that's coming up in a moment. So I'm going to table that answer until we get through the next series of slides.
Okay. Let me just double check and see if we have any hand raises. No. But the questions are coming in very smoothly, so.
Okay, great. Thank you. Okay, so this is a really important slide I want to point out to folks, because I'm hoping that anybody who has not heard this before hears it now. In the past, if you were a permanent supportive housing program, whether that's SHP or Shelter Plus Care, and your project was chronic dedicated, so that means when you applied to HUD, you told HUD that you would only serve those individuals who meet the chronic definition. In the past, there have been a lot of instances where we've been contacted to say, we don't have anybody chronic in our county. In fact, I have in the archives of my files specific examples that we've sent to HUD over the years to say, not only does this person not have anybody chronic on the waiting list, they can't identify anybody chronic in their county. In fact, over the last umpteen years, they have not had a chronic individual identified during the PIC count. There's no chronic individual or household in HMIS in their county, nor the surrounding counties immediately bordering this particular county. That's a true story. That was an example we sent to HUD. They still indicated at that time that we should hold the bed open until we find somebody to place in that bed. There's a new day. That is no longer a requirement. As long as, obviously, if you have committed to HUD to serve chronic, we absolutely want you to be serving chronic in those beds. But if you go through the procedure that we just walked through and you are not able to identify, whether it be in your county or in any of the counties in the COC, somebody who, A, meets the chronic definition, and B, is willing to relocate to wherever your program is located, you can then serve somebody who is non-chronic as long as they meet the eligibility requirements for permanent supportive housing and as long as you are following the non-chronic prioritization that we will be going through in just a moment. So this is a huge shift for programs in terms of operating. If you have had a chronic project for a very long time, you have most likely run up against this in more than one occasion where you were not able to fill a bed for a period of time until somebody could be identified as chronic. So if there are questions about that, if you want clarification about that, you can call us, but I will tell you that this is very clearly spelled out in the HUD notice that we referenced when I first began talking. Okay, next slide, please. All right, so this is the prioritization for non-chronic. I'm not going to go through the layout because it's exactly the same, except for this is non-chronic. As you can see there, the second column down says no all the way, which implies that these are folks who are not meeting the HUD chronic definition. So who gets first priority if you do not meet the HUD definition of chronic, but you are eligible for permanent supportive housing? It would be for somebody who has, as row 1 there shows, a severe service need and somebody who is coming from the streets, the 2 safe haven programs that we have in the balance of state, one in Washington and one in Westmoreland County, or an emergency shelter. So somebody with a severe service need who is coming from a place that is considered to be literal homeless, okay? Second priority, does not have a severe service need, is coming from literal homeless, street, safe haven, or shelter, plus has at least 6 months continuously homeless or at least 4 occasions in 3 years. So doesn't quite meet the full chronic definition, but it has evidence of having multiple episodes and time spent homeless, but just not the full time required under the chronic definition. Thirdly, again, no severe service need and coming from the streets or shelter. So almost like one, but the difference there is that in the first priority you had a severe service need, and the third priority you did not. And then in the fourth priority, still does not have a severe service need, but this time it includes coming from transitional housing if you first came from the streets or safe haven or emergency shelter. So they still must have a disability, even if they don't have severe service needs. Permanent supportive housing eligibility requires disability regardless of chronic status. Next slide, please. Okay. So how are we going to implement this prioritization? What is the procedure? So all households on your waiting list should be prioritized in this way for permanent supportive housing assistance. This includes folks on your waiting list and those folks who are identified through whatever process you have for receiving referrals from your partners within your county or your defined service area if that's larger than just your county. So again, your service area is defined within your project application. If for some reason folks don't know that, check there as to where you've indicated you will be receiving folks from. But all folks on your waiting list and through referrals, regardless, before you assign the next turnover unit, you should be prioritizing folks based on the chart that we just reviewed. Next slide. Okay, how will this be monitored? This is one of the things that we've been talking about recently. One of the things that HUD is expecting the COC to monitor for a number of reasons, including the fact that we want our number of those experiencing chronic homelessness to go down. And so we need to make sure that our resources, the tools that we have to decrease chronic homelessness are being used in order to pursue that goal. So for the East, this is the only place in the presentation today where there's sort of a slight nuanced difference between the East and West. So for the East, we are working with DCED. We've had one conversation so far, and we are going to be looking to develop some type of report but that will allow us to use data that's entered in HMIS to track how frequently chronic households are being placed into vacant permanent supportive housing units. So, for example, if we run a report between April 1st of last year and March 31st of this year, we have one full year. How many people entered your program? 5 people entered your program. How many of those were chronic? 1. Okay, so we know that 1 out of 5 folks who entered your program therefore met the chronic definition. That's the kind of information we're looking to be able to draw from HMIS. If once we get some type of report able to be run, it does not seem to provide the information that we need, that process may have to be revised and changed as we learn more, A, from HUD about how the requirements may change, and B, what kind of data we can get from HMIS to show this. Next slide. Okay, in the West, this is something that the Western PACOC has been tracking for a few months now, and that is done through the Chronic Prioritization Turnover Unit Survey. The website is there. It's very small, but hopefully everybody has the link already. As you can see, if you haven't looked at it, the screen there on the left shows the first few questions. It's not much longer than what you see there. In fact, I think that may be the final question, phone number there at the bottom. But it basically just asks you to provide your organization name, program name, the date the unit became available, the date somebody was placed in that unit, and the characteristics of who was placed, whether it was somebody who was chronic or met one of the other HUD priority populations, and then also what the process was for you to identify somebody to place into that unit. This is going to be updated slightly to make sure that it is compliant with the non-chronic prioritization that we just reviewed. So this is really mostly asking about the chronic prioritization. It's going to be slightly expanded to make sure that we're also serving those based on the priority order from HUD for the non-chronic prioritization as well. Again, as it states there, the process may change over time. As we have improved HMIS data, as our HMIS data, capacity increases, also under coordinated entry, this process, again, may change over time. So with that, I would just ask if folks have any questions. I think Barbara wants to make a comment. If you have any questions related to the, again, the non-chronic prioritization process or any other part of the webinar, or something you were hoping to hear in the webinar that was not included, if you want to raise your hand or type in a question now, that would be great.
Lee, first question. For non-chronics, is it service area first? Apparently they didn't pick the person didn't pick it up from the presentation.
Sure. So if your service area is your county, then yeah, the answer is yes. If your service area is your county, or if it's a couple of counties, that would be where you would look beyond. First, it would be your waiting list, and then if you do not have somebody on your waiting list, there are programs that do not maintain a waiting list. In that case, you would need to reach out to the organizations that you receive referrals from within your defined service area. And the assumption, that doesn't go on because the assumption is that within your defined service area, you're going to have somebody who is eligible for permanent supportive housing. Again, this does not have to be somebody who is chronic. So if that is a false assumption, I don't think that we typically hear any sort of comments about folks not being able to find somebody to fill permanent supportive housing units. But if that is the case, then feel free to either indicate that now or to be in touch with us so we can talk through that.
And Where does the survey get sent to?
So the survey, once it's submitted, it basically, all of the responses are sort of fed into a spreadsheet or a database, and that information is made available to the Western COC Executive Committee, and at some point it's reviewed. At some point, if there is a specific subcommittee that is looking at this data, the data may also be shared with them, but at this point it's really just used by our office and shared with the 4 members of the Executive Committee in the West.
Okay, and does the survey get filled out during the move-in or the move-out?
It would be filled out during the move-in because you're going to be indicating who was placed into that unit and the method used to identify that individual or household.
Okay. Now moving to the Q&A section, where I have a couple questions there. Is the Code of Federal Regulations going to be updated to these HUD changes and program name changes?
Program name changes.
Going to the program name changes, that was changed under HARTH. Shelter Plus Care and SHP-PSH was changed under HARTH to all be COC, Permanent Supportive Housing. I believe that is the question, and it has already been changed with HARTH. If that's not the question, re-enter it or send it to us.
Okay. The next question is, are the verification of chronic/disabled status only required for the permanent supportive housing, or would it also be required for rapid rehousing projects upon entering the information into HMIS as part of a regular intake?
Okay, so unless, a program was designed and somehow it's in their agreement with HUD that they are serving a specific population that must have a disability, the answer is no. In order to be eligible based on the broadest definition of eligibility for rapid rehousing, one does not have to have a disability. So in some cases, and I don't mean to muck this up for folks, but in some cases, if you have an individual or household that's been identified as chronic and you don't have a a permanent supportive housing unit available, a resource that can be used is placing that household into housing using rapid rehousing assistance. And once you have a permanent supportive housing unit available, that individual's shifts into the permanent supportive housing and out of the rapid rehousing program. In that case, they would maintain their eligibility for permanent supportive housing and would maintain their chronic status. But in general, rapid rehousing eligibility does not require a disability.
All right, so we have a scenario with a question.
Okay.
My program has had an open bed for permanent supportive housing transitional age for 6 months with no waiting list. We have a potential consumer that has had 4 months in the past 12 months of homelessness. Are you suggesting, since the bed has been open for so long, we could allow the consumer in the program?
If that person meets the requirements for permanent supportive housing, which were reviewed in Webinar 1. So today's webinar really focused on the eligibility as being certified as chronic. But if they meet the definition, if they meet the eligibility requirements of permanent supportive housing, then my answer would be absolutely yes. So if that transition age youth has a disability, if they are presently on the streets or in shelter, or if they're in Washington or Westmoreland County in a safe haven, then yes, that person should be moved into the permanent supportive housing unit, assuming they meet any other eligibility requirements.
But do they need to go to the entire service area first to see if there's a chronic person ahead of this individual?
That would be correct, yes. if they have not, thank you, if they have not sort of done the other due diligence that's outlined here, which is only a 7-day. So if you don't have anybody chronic on your waiting list, right, then you reach out to your service area, the full COC, et cetera. But the expectation is that you don't hold that unit open for longer than 7 days. If that step has not yet been done, as Barbara pointed out, yes, it should, the available bed should be advertised to the service area and the full COC if necessary. And then at that point, again, assuming the individual meets the eligibility requirements for permanent supportive housing, the bed, yes, could go to that individual.
And just adding to that briefly, for the first time, I think, HUD is emphasizing we do not want empty beds. These resources are too valuable. There are too many people homeless to keep a bed empty. So that is a radical change. And I think it's a radical change that may have been directed towards the rural communities where chronic beds were awarded, and it's hard to do the to fill them.
Okay. That is all the questions I have. In regards to hand raises, I don't have any right now.
So the only thing, nobody specifically asked this question, but something else I just want to point out. In the last, I would say, week or so, I've gotten 2 or 3, maybe even 4 questions from different folks about how to track and maintain soft contacts. Basically, somebody comes in, requests assistance. They may or may not accept it. They may or may not be eligible for whatever opening you have. You may provide a referral, which they may or may not utilize, et cetera. But they have come into your program or into your county and identified as being homeless. How do you track that information in order to better build the case at some point in the future that this individual is eligible for permanent supportive housing as a chronic household? It's a very good question. I've gotten a couple of examples already sent to me. If you're using some type of internal spreadsheet or tool that you would like to share with others who are on the call and throughout the COC, please feel free to forward us that information. But it is something that we are beginning to talk to Dave and Brian about at DCED, and we hope that through the development of coordinated entry that some of the need for something like that will be met. However, we recognize the potential need to have something in the interim to be able to better track folks identifying and requesting assistance as homeless who may not be entered into HMIS like a regular participant because they, in fact, did not receive any assistance from your organization. So for any of you who are listening who are in that situation, you know, feel free to let us know that and let us know if there's any sort of special nuances about the struggles that you're running into, because we're in the process of really starting to look at this to identify ways that this information can be more manageable and more consistently tracked on your end.
Okay, back to Barbara for a minute. Just a couple of other items before we get on to discussing Webinar 3. And that is you will, like after Webinar 1, you'll receive a survey from us. It only takes a couple minutes. We just really want to know whether we are giving you what you need, because this is for you guys and we want it to meet your needs. So it's important for us to hear back from you. Again, this webinar, both the slides and the handout on chronic homelessness that went out this morning, and the recorded webinar will be on the website. When the recorded webinar goes on the website this time, it will also have a registration function. So anyone who watches it from day one will have that registration available. It took us a week to get that in place last time. We apologize. It will go on immediately this time. And then just another sort of side issue for those of you who are grantees and wondering about the award announcements, application schedule, and all of that. I just wanted to tell you what little we know. We know that last week HUD, what we knew is in the NOFA, HUD told us within 90 days of submitting the application, which was that would have taken us to sometime towards the end of February, we were supposed to hear the results of both Tier 1 and Tier 2 programs, grants. We last week heard the results of Tier 1. Tier 2 is harder for them to tell us because they have to read the whole Exhibit 1, score the Exhibit 1, and then go across every COC in the country and score all the Tier 2 projects against each other. It's a huge, huge task that they didn't meet the timeline they had anticipated. We don't know when Tier 2 will be announced, nor do we know how we'll do. We're only hoping that we did well nationally. We usually do, but a different application, a different world. We're just really hoping that we do well. You will know as soon as we do. So what does that all mean? That means there are a number of programs in both the East and the West are still waiting to hear whether they were funded. For those of you who are in Tier 2 and your grant, so those of you who are in Tier 1 and your grants have already expired, sit tight, you will have a contract with HUD and you'll move forward. Those in Tier 2 whose grants have expired or will shortly expire, we don't have a lot of information for you. I've been contacting those who expired in the first quarter of the year to make sure everybody knew that they are now in limbo, and we're hoping that everything will be fine, but we don't have full information, and it's totally out of our hands. We are hoping for the best, but we just want everyone to be knowledgeable of what's going on, see what other funding sources they can identify if need be. In terms of what this all means for the next application schedule, again, we were told that the next application would be spring. Spring has happened. It's daylight savings time. All that stuff has happened. And we are not all that close to the next application because the next steps will be the announcement of the Tier 2 projects. Then there's a step after that in which HUD sends out this dreaded form called the Grant Inventory Worksheet, which is a very large spreadsheet that can't be printed, and we have to review that to make sure all the budgets are correct and that all programs that need to be renewed appear on it. And that can't come out until after the award Tier 2 because you don't know what you have to renew till you know what you have. So I know it sounds complicated, but the next thing we're waiting for is the Tier 2 announcements. Then we're waiting for the Grant Inventory Worksheet. They usually give us about 3 weeks to mess around with that. Then the next step is called the COC registration step, and that's when HUD decides how much money is available for the COC for both new, renewal, and planning grant, and that's another about 3 weeks. So we see ourselves at the soonest, May, very soonest. Lee, shake your head no, I agree. We're talking summer. So anyway, we will absolutely keep you posted as we sort of crystal ball timelines. We'll let you know what we guess, but it's not imminent, and they had told us it would probably be spring, so if we ever told you that, it is not spring. It's going to be summer or fall again. So that is where we are on the application schedule because we get asked a lot. People are planning vacations, weddings, babies, things of that sort. We don't know. Okay, and then on to webinar number 3. The next webinar will be Tuesday, April 19th, 1:30, again to roughly 3 o'clock or however much time is needed. We're going to get off of this one in 2 minutes. The topic is implementation question and answer session. We have a few topics identified. We will be prepared. However, we would love for you to send us topics. Strongly, strongly, strongly encourage you. Send us implementation questions, things that you feel like you're kind of doing but not 100% sure you're doing them right. Maybe if you're a new staff person and they're just things that are just bewildering to you, please send them in to us and we'll work them into this. This is a question and answer one. We will have some prepared information, probably of things like leasing versus rental assistance and what's eligible under which and things of that sort. But we really are looking for input from you. What do you need to know to properly implement your program? So we are awaiting emails from you. Please send them into PA_COC@hotmail.com. So we just want to again thank Dave for his technological assistance in the background there. Keeps us honest. And thank you everyone for being a part of it. We'll talk to you again in April. Okay, bye-bye.
Thank you.
Thank you.